Hey guys, I'm esthetician Trish McCarty, and today I'm going to do a Glytone eye and lip peel on myself. This chemical peel is designed to brighten the area, to diminish the look of fine lines, to wrinkles. It can help, but you do want to be realistic. If you have very deep wrinkles, this probably isn't going to be strong enough. Now, we do recommend this in a series of 4 treatments, as often as 1 week apart. It does help with dark circles, hyperpigmentation, sun damage, and just overall helps the appearance and brightens things up, and it produces collagen. So if you are someone like me who has dark undertones, dark circles, it does help to fill in that area with collagen so that you don't see the blood vessels as easily. So it does hide some of those dark circles by restoring collagen in the area. So first we want to put a little bit of a barrier here so that this chemical peel does not seep into my eyes. Now, I would do this a little differently if you were coming in to see me as a patient. I can't do this with my eyes closed. Now, I could certainly get a coworker to do this for me, but getting us all not busy at the same time and someone who's been trained is a challenge. So I'm putting this here because when you get a peel right on your nostril area or like right below it, it burns really bad and gets raw, and there's really just no reason for it. You're just torturing yourself or the patient for no reason. So if I were my own patient coming in, I would put this over the eyelids, all around the eye. The mouth, people assume that we're putting the peel over the lips. We're actually going around the lips, and we're focusing on the border of the lips to make it stand out more and to make it healthier. And this also prevents those wrinkles that a lot of people get as they age. So I'm doing this more as prevention and to brighten up the lip area and the eye area. I can do this with laser as well, but some people are scared of laser, so we do have peels available. And to my knowledge, this is the only chemical peel approved for the eye area, and I don't really know of many that's specific for the lips. So first, I prepped with one of these prep wipes, and then to neutralize, I'm going to use these neutralizing wipes. Now, a smart provider has all of this ready in case their patient does not tolerate this well. And this can stay on up to 14 minutes. So what I like to do is you put a new tip for every patient and squirt this out like so. So this is a real thick gel-like consistency. And when I am treating a patient, I always have them keep their eyes closed for precaution, but also for this one, I get right up on the actual eyelid. So of course they're gonna need their eyes closed for that. And you can layer this up to 3 or 4 times to make the peel stronger. So every time you layer a chemical peel, the stronger it becomes. So you can see I have some dark circling right through here that I really want to be mindful of. Also want to get out here and prevent some crow feet, as well as treat what I have. Now in this video, it probably doesn't look like I have deep crow's feet, but if I were to wear makeup, trust me, I have some crow's feet going on. And when I smile, see, I don't have completely perfect skin, but I choose to do things like this rather than Botox, Dysport. That's just my personal choice, is to do anti-aging with product and in-office treatment rather than injectables. I try to live a mostly natural lifestyle, the best of my ability. And see, I get really close to that border. This is stingy, but not terrible at all. It's very tolerable. But I have extremely sensitive skin, and this does have PCA, so it does make it kind of strong. So I'm pretty sensitive, so I really pinked up. I don't know if you can tell, but I'm kind of red in a way. Now, most patients barely have any evidence that they had this done. I had this on not even 10 minutes, and it can be left on up to 14. Most of my patients are able to leave it on for 14 minutes, but again, I'm extremely sensitive. But I will say, every time I do this peel, even though I can't leave it on the full time, I do see a brightening of the area and a difference, and I'm going to insert my before and after pictures of the last time that I did this. Here's what I look like immediately after treatment. This is a safer peel to use in the summertime, depending on how careful you are, how mindful you are at reapplying sunscreen. You don't want to purposely tan to be tanning and get any kind of chemical peel, but if you are the type that wears sunscreen every day and is mindful, then we can do a chemical peel, microneedling, even some lasers in the summer, depending on you. So this is a great refresher for the eyes and lips. So I hope you found this video helpful, and make sure you give it a thumbs up and share with your friend, and I will put pricing in the description down below. Thanks so much. Bye.